Now we continue our A Turning Point series. This February, we are focusing on Black History Month with a special spotlight on health and wellness.
Tonight, our senior commentator, Leon-Bibb, shares the renewed attention to increase the numbers of Black doctors nationwide and a look back at those efforts here in Cleveland.
It was the first interracial hospital for doctors in Cleveland. In 1957, Forest City opened its doors. Its reason for existence is rooted in the racist practices of the main hospital systems in the city at that time.
The fundamental problem was that Black doctors could not access hospital in Cleveland. Thanks, babe. Thank you very much. Oh, and this is when I was class president in med school.
Dr. Edgar Jackson, a retired high-level administrator at university hospitals, remembers.
Doctors were allowed to put on a white coat and go see patients at the Cleveland Clinic, but they couldn't admit them and they couldn't write any orders. So basically, the Black doctors were iced out of the hospitals in Cleveland.
When Forest City was established in the late 50s, the surrounding Glenville neighborhood was becoming predominantly African American. Dr. Jackson, who joined the hospital in the early 60s, said the facility felt like family. He could see the difference it was making.
It's clear that having more minority doctors helps because compliance of patients improves. People are more likely to go to the doctor, more likely to do what the doctor says.
But as times changed, admissions fell, and Forest City closed in 1978. And for decades, African-American enrollment in medical schools remained stagnant.
At the time I was applying to medical school, I entered in 1980. Between 1978 and 2019, the number of Black medical students was flat in the United States.
I talked with Chief Surgeon of Rainbow Babies and Children's Hospital, Dr. Edward Barksdale, who is also professor of surgery at Case Western Reserve University's School of Medicine, and his son, Trey, a fourth-year medical student there.
And one of the driving factors for coming to Case was the breadth of what Case had to offer and the people they were bringing in. And I remember our class was one of the largest groups of minorities to enter into Case.
Trey's experience reflecting hope for a turning point. U.S. medical schools reported a record 21% increase in Black students enrolling from 2020 to 2021. But as Dr. Barksdale points out, there is still work to be done.
There are miles to go before we rest. Miles to go before we rest. I'm hoping my son will be one who will continue to carry things forward.
63 years since Forest City Hospital was established as a center for Black doctors to practice medicine, the goal of increasing their numbers remains the same. For Dr. Barksdale, the seed of believing a person can be a doctor must begin in
elementary school, to help people recognize that they can do STEM, to help young men and women of color recognize that science, technology, engineering, and medicine is important. Never forget that you have a responsibility once you rise to help others get over the hurdles and obstacles they face.
For 3 News, I'm Leon-Bibb.
Dr. Barksdale has been active in the effort to increase representation of medical school students of color, and he shared some additional data on just how much more work there is to do in the space, and we have included all of that information for you at WKYC.com.